Today we have Dr. Young from Pacific Eye Institute with us. He is a board-certified ophthalmologist specializing in glaucoma, comprehensive eye care, and cataract surgery. Today he will discuss cataract lens options, focusing on light-adjustable lenses, LALs. Dr. Young, whenever you're ready, feel free to start.
Sounds great, Genesis. Thank you for the warm introduction and for arranging all this. And thank you everyone for making it out here on this Thursday afternoon. So, welcome. Thank you for sharing your lunch hour with me. So yeah, today we're going to be talking about this topic here. So we're going to talk about the process of cataract surgery and also some of the different lens options out there. And we're going to feature, of course, the light adjustable lens, also known as LAL. Yeah, so, with that, my name is Edward Young. I am one of the refractive cataract and glaucoma and comprehensive doctors at Pacific Eye Institute. So if we're ready, let's go ahead and move on forward with this, okay? So this is going to be the agenda for today. And so we're going to talk about a couple of things. One is, how does cataract surgery work? What is it? What are some of the limitations of some of the different lenses out there? And then we're going to talk about the light adjustable lens, also known as LAL, and we'll kind of talk about whether or not this is something that may be right for you in the future when you decide you want to move forward with doing cataract surgery. So to start out, what exactly is a cataract? So, this at the bottom left here is a picture of an extreme version of a cataract. So this is not what you want to get to. You can see this from across the room, and clearly you can see that this person is not going to be able to see. But in reality, most cases of cataracts will actually be much milder than this. Usually the symptoms are going to be blurriness with distance, intermediate, near, some difficulty with reading and driving, and also difficulty with glare, especially with nighttime driving. Now, this last symptom is probably one of the most common complaints that we have as cataract surgeons in terms of patients who present to us with cataracts. A cataract itself, it's the natural lens in your eye. Every single person is born with it. And over time, it gradually becomes denser, it becomes hazier, it may become a little bit yellow colored. And as a result of that, it affects your vision over time and makes it so you're not able to see what you would like to be able to see. Surgery is the process of actually removing this cataract and then replacing it with a clear artificial lens. And nowadays, it is the year 2024. Realistically, the options for cataract surgery are no longer as limited as they used to be. And as a result, we'll go over a lot of that stuff. And you can see that, some of the more subtle symptoms of cataracts, you can see down here at the bottom. On the left, there is a picture of a flower with a clear sky that you can see is blue, the colors are vivid and so forth. But on the right, that is what you'll see when you have a cataract. Things become a little bit more washed out in terms of the colors, and also clarity is no longer as good as it used to be. And so that's where cataract surgery comes in. So cataract surgery comes in a couple of different forms. There is the traditional manual cataract surgery, also known as phaco emulsification, which performs the cataract surgery using the standard forms of techniques that we've always used. And then recently, which we've acquired here at Pacific Eye, we have the ability to do femtosecond laser-assisted cataract surgery, also known as FLACS. And what that does is that it allows for a couple of things. It uses the laser to do automated reduction of small amounts of astigmatism. So about 1 to 1.25 diopters of astigmatism or less, we can reduce that with a laser. It also results in faster cornea recovery. So when we do cataract surgery, this laser helps to actually break open the lens a little bit. It does a couple of key steps. And as a result of that, it causes it so we have to do less manipulation inside of the eye. And also it allows us to be able to take out the cataracts with less ultrasound power or phaco power. And finally, because it's automated, it's a laser, there's greater consistency with some of the key steps in cataract surgery. And as a result, it just makes it more predictable in terms of the outcome. This right here is actually a video of some of the steps being performed using the femtosecond cataract surgery. And so you can see Just like that, what has happened right there is that the laser has opened up the lens, which is the cataract, and has broken it up into four different pieces. And you can see, that makes it very quick, it makes it efficient, and as a result of that, of course, the recovery will be a little bit faster. And then after, of course, once the cataract is taken out, we then put a lens inside of the eye. So questions I tend to get asked is, do I have to have a lens inside of the eye? The answer is yes, because without any lenses inside of the eye to replace the natural lens that has been taken out, you won't be able to see much at all. You'll need Coke bottle lenses in your glasses afterwards if you do not have lens placed into the eye. And so there's different options. In the past, some of the traditional ways of cataract surgery involve just placing a standard monofocal lens, which basically means it's a standard lens that allows you to be able to see distance for driving without needing glasses if you do not have astigmatism. If you do have astigmatism, it will have to involve having to wear bifocal or progressive lenses full time for you to be able to continue to see well. Toric monofocals get rid of regular astigmatism so that you can see distance if you have astigmatism without the need for glasses, but it will not get you out of glasses to be able to see intermediate to near. So that basically means we're looking at the dashboard, looking at the computer, looking at your cell phone, and reading. You would need glasses for all that stuff still. And that's because these are monofocal lenses, which allow you to be able to see one thing, which is distance. We then move into some of the earlier iterations of premium lenses, which are your diffractive lenses. Diffractive, what it means is that there are little ring patterns on the surface of the lens, which will give you different steps to allow you to see different ranges of vision. So there's the extended depth of focus lenses, which are the ones that allows you to see distance to intermediate and functional near. What that translates to is that you'll be able to see from far away for driving. You can see the dashboard, you can use the computer, and then cell phone about like an arm's length away, you'll be able to see, but then for reading, you'll still need glasses for that. The trifocal overcomes that final hump in that it allows you to be able to also see near as well as distance and intermediate. But the thing is, these two are diffractive, meaning that they have rings, and as a result of that, people may get glare, halo patterns, and so forth, especially with nighttime driving. And because some of these are the same symptoms that people have even when they had a cataract. And so for some people, they're trying to get rid of these symptoms. A non-diffractive extended depth of focus lens is one of the later ones that we've had recently, which is that it still gives you that range of vision from distance to intermediate and functional near without the glare symptoms. So non-diffractive means there's no rings on it. And as a result, it gives you a range of vision without having to use glasses, without the added risk of glare. But just like the diffractive EDOF or extended depth of focus lenses, it will not get you to be able to see all the way up close with reading. And that's where the light adjustable lens comes in, because this actually overcomes a lot of these different weaknesses that we've talked about so far. So other weaknesses of some of the lenses that we've talked about is that they are based on lens power calculations before the surgery or during the surgery in order to predict what is the refractive outcome. But of course, as you know, no two patients are the same. Well, that applies with the eyes too. No two eyes are the same. And as a result, these standard calculations are not custom tailored to the individual person's eye, and they may not always give the desired refractive outcome. And like we've talked about, some of the diffractive lenses may cause glare and halos. And so that's where the light adjustable lens comes in. So the light adjustable lens is the first and only lens that allows you to optimize it after the surgery. So how it works is that after the cataract surgery, we use UV light to be able to reshape the lens after it's already been implanted. And these are all non-invasive light treatments that don't require any sort of anesthesia, doesn't require any sort of surgery. And as a result, it doesn't involve any additional procedures that have to be done in an operating room setting to make it to get you to see what you want to be able to see. You can test drive your vision for up to a total of 3 tries, and so it gives you the option to be able to try it out and see if you like it, with the option for further adjustments down the line. And this is kind of a schematic of how the light adjustable lens works. So after been implanted, the lens itself has an active shield, which will help to block the UV light coming from outside, although we still typically recommend wearing UV protective glasses that's provided to you as a extra step of safety. An adjustment beam is then used in order to polymerize these particles called macromers, and this is delivered using a light delivery device that we have here in our clinics. What it does is that it polymerizes it in a certain pattern so that the remaining particles or macromers will then migrate into the unpolymerized locations, and then it'll change the shape of the lens as a result of that. And then it allows you to do this a couple of times. And then once it's all set to the point that you are happy with it, we then expose the entire lens to a diffuse UV beam that will then go ahead and polymerize the remaining particles of macromers. And that will retain the shape of the lens and give you the final desired outcome. This right here is a picture of how the delivery device looks, and it's in our upland location. So you don't have to travel too far for it or anything like that. And this is done after the healing is complete after the cataract surgery. It's able to correct up to as small as 0.25 diopters of nearsightedness and farsightedness and astigmatism. And it can correct astigmatism even as low as half a diopter or half a degree, which is way better than essentially any other lens is capable of doing. And for the most part, it's the same as getting the same as having the best pair of glasses on your eye or soft contact lens on your eye without you having to wear the above. These light treatments are completely painless. They're done in our office, they're non-invasive, takes about a minute and a half. And how it works is that after the eye is done in the operating room, we wait about 17 to 21 days after the cataract surgery is done. And then we start the first treatment. We send you home. And then a week later, we have you come back after you've test driven it for about a week. And then we ask you, do you like the results or do you want to be able to see a little bit clearer for distance, a little bit clearer for up close? And then we can adjust it further. And then you go home and then the same thing, you come back 1 week later and we see how you do. Once you're happy with the results, you have two lock-in visits where, like I mentioned, we expose the lens to diffuse UV light to lock in the remaining macromers. And then after that, you're set. So overall, it takes about 6 to 8 weeks or so before you'll be done with the whole treatment process. So of course, after we've shown what the technology is and how it works, what are the outcomes? So this is probably going to be a little bit more in depth than probably some of you will want to know, but this is actually a study showing what the light adjustable lens does in a real life setting. So they took about 738 people who underwent the bilateral implantation of the light adjustable lens out of a total of 80 different practices. This is actually the IDE study that actually got the light adjustable lens approved in the United States. They collected results after 3 months after the final lock-in visit, and they customized each patient to what they wanted to be able to see after the surgery. And so these are the results. So most people choose to have blended vision, which is where they have their dominant eye be able to see distance intermediate, and then their non-dominant eye to be able to see far intermediate to up close. And what that does is that it gives you that range of vision from far to near as a progression. Some people who, let's say, for example, they're an airline pilot or they're a truck driver or something who really demands distance vision, they don't want to risk the quality of their vision at all, or they have some strict requirements on their license, may choose to have bilateral distance vision. And very few people want to have bilateral nearsightedness. And this is the visual outcomes. And so on the left is a chart that demonstrates the mean refractive spherical equivalent, which basically translates to what is the diopter or power of glasses to get you to be able to see what you want to be able to see. And so you can see here that about 80% of people will be able to achieve within 0.25, which is almost a negligible prescription of what they'll be able to get to what they want to be able to see. And then 93% will get to within 0.5 diopters or half a degree of what they would need to be able to see exactly what they want to be able to see. So keep in mind, these are pretty much negligible prescriptions in lenses to be able to get people to see what they want to be able to see. On the right here is astigmatism, and you can see it's very similar. So 93% of people will be within 0.5 diopters or degrees of the amount of astigmatism to be able to get them to see what they want to be able to see. And once again, this is a negligible amount. Most people will not be able to notice this at all. And what that translates to in vision is this. So it means that for their distance vision, they're able to see 20/20 or better in their dominant eye in about 80% of cases. And over 90% of people will be able to see 20/25 uncorrected in their distance eye. So, I mean, most people cannot really tell even the difference between 20/20 and 20/25 when they're being checked for driving. It's mainly something that they'll see only when they're taking an eye exam. And now, for those of you who might have had a prior history of LASIK or PRK, not to worry. This lens is actually very compatible, and if anything, it's probably one of the best lenses to have for people who have had LASIK or PRK, in that unlike some of the other lenses out there, it doesn't compromise quality of vision if you've had a history of refractive surgery. So you can see here that about 25% of the people who were included in the study had a history of LASIK or PRK, and you can see that at the end of the day, the eye that was set for distance, average vision was 20/20. And the mean refractive error for both astigmatism and also farsightedness and nearsightedness is about 0.25. So you can see overall very, very good distance vision, with the use of the light adjustable lens. And for people, like I said, most people opt to have blended vision, which is the third row that you see here. So you can see that when you do bilateral distance vision, vision is excellent for 20/20 or better in 89% of cases, uncorrected, so without glasses. For near, you can see that it does give you some near vision, but it's not as good on the second row. So you see about 20/30, 20/40 for near if you set both eyes for distance. But when you do this blended vision, which is what 70 to 80% of people usually go for, you can see that it's excellent. So still 80 to 90 something percent of people will get 20/25 or better for distance vision. But then for uncorrected near vision, you can see that 84% of people will see about 20/20 to 20/25. And then 95% of people, so almost everyone will usually see 20/30 or better with near vision if you go with a blended vision route. And this is once again uncorrected, meaning no glasses for reading. So in summary, what it all comes down to is that, we went over a lot of data, but the light adjustable lens is an excellent premium lens option for pretty much anyone. So as long as the eye dilates to 6.5 millimeters or more, it is an option for you. And the fact that it's adjustable and customizable for the individual person's eye makes it deliver the best possible refractive outcomes because it customizes it to your individual needs. It gives great vision for distance, intermediate, and also near. And the main thing is that there's no contraindications in terms of other diseases of the eyes. And so, for the most part, other premium lenses that we've talked about so far, they sometimes will, have limitations, meaning that if you have glaucoma, if you have retinal disease like macular degeneration, you may not want to use some of those other premium lenses that we've talked about at the beginning of today's talk, but the light adjustable lens really doesn't have these issues. And furthermore, unlike some of the other lenses that we've talked about, there's no decrease in contrast in low light settings. There's no added risk of glare and halos. And once again, these are issues that some of the other lenses that we've talked about pose that the light adjustable lens really does not have. And so with that, my part of the talk is pretty much over. So if at this point, if you have any questions, well, to open it up to everyone, and you can feel free to just shout some questions or type in some questions in the chat if you don't want to do that. But regardless of which, thank you for making it out here today.